Hello, everyone. Thank you for joining us today on our webinar. My name is Chelsea Sprouse. I'm a pharmacist at the Virginia Department of Health, and today we're going to be talking about Evusheld. So for Evusheld, it's used for pre-exposure prophylaxis in adults and pediatric patients who are 12 years and older, weighing at least 40 kilograms. Specifically, Evusheld is used for those who are moderately to severely immunocompromised, either due to a medical condition or if they receive any sort of immunocompromising, immunosuppressive medications. It's also for those who are not currently infected and have also not had any kind of known recent exposure to an individual infected with COVID-19. With that being said, there are some limitations of use for Evusheld. Some of those would include not being authorized for use for the treatment of COVID-19, so only for pre-exposure, not for treatment and not for post-exposure prophylaxis for anyone who might have come in contact with anyone with COVID-19. Evusheld is also not a substitution for vaccination. They make that very clear in the EUA. So anyone who is eligible to receive the COVID-19 vaccine should go ahead and get the vaccine. However, for those who either can't have the vaccine, maybe they had a history of a severe reaction, or if they had an allergic reaction, those patients might be eligible for Evusheld. Also, in individuals who might have received the COVID-19 vaccine, but they weren't able to mount an adequate immune response to the COVID-19 vaccine due to their immunocompromising condition, those patients could also be eligible to receive Evusheld. Now, for individuals who received the COVID-19 vaccine, Evusheld should be administered at least 2 weeks after that vaccination. So if you look at the opposite scenario, for individuals who received Evusheld first, there is no waiting period to receive the vaccination once the patient is eligible. So as soon as they're eligible for their first, second, or booster vaccine, they can go ahead and get that. The dosing for Evusheld per the EUA is an initial dose of 300 milligrams of tixagevimab and 300 milligrams of silgavimab, administered as 2 separate consecutive intramuscular injections. Now, this is a change, a recent change. It was previously half of the dose. So it was originally 150 milligrams of each product. So for those individuals who had initially received the 150 milligrams of tixagevimab and 150 milligrams of the silgavimab, those patients should receive a second dose of 150 milligrams of each product as soon as possible. With that being said, any subsequent repeat dosing should be timed from the date of the second Evusheld dose in this population. So as soon as they've had the full 300 milligrams of both product, any repeat dosing needs to be based off of that. More in regards to the repeat dosing, Evusheld has only been studied as single dose studies. So there's not really any safety or efficacy data that we can go off of for repeat dosing. However, in the PREVENT trial, they did indicate that Evusheld might be effective for about 6 months post-administration for pre-Omicron variants. They do talk about the different variants and how Evusheld acts against those. So in the studies, the researchers looked at the neutralization of the COVID variants. So that is the ability of the antibodies to block the site where the virus enters into the cell in the body. So the studies showed that there's a decrease neutralization activity for Evusheld against Omicron subvariants BA1 and BA1.1. Alternatively, the neutralization activity of Evusheld against the Omicron variant BA2 is minimally impacted. So taking this into consideration, the SARS-CoV-2 variants that will be circulating when Evusheld might need to be redosed for our individual patients, it's not known at this time. So since we don't know the variants, the EUA for Evusheld does indicate that repeat dosing recommendations cannot be made at this time. But with that being said, it is up to the prescriber's discretion. The fact sheets and EUAs of Evusheld will be revised when we get more data regarding repeat dosing. And as far as contraindications, there's really not a lot of contraindications. The only one that's noted is if anyone previously had Evusheld and had any sort of allergic reaction, anaphylaxis, that type, to any component of Evusheld product. For other warnings and precautions, it is an intramuscular injection, so Evusheld should be given with caution to individuals that might have a bleeding disorder, such as thrombocytopenia, so they would be at an increased risk of bleeding. Also, providers have expressed a concern about the cardiovascular adverse events, which has led to one reason why there hasn't been a huge uptake in administration of Evusheld is because of these adverse events. But I will say it is very important to note that these events were very infrequent in clinical trials. So the cardiac events that occurred only occurred in 0.6% of the population in the therapy arm, so those who received Evusheld, and they occurred in 0.2% of participants in the placebo arm, so those not receiving Evusheld. Another very important fact is that all the patients who had any type of event had underlying cardiac risk factors or had a history of cardiovascular disease prior to the clinical trial. So with that being said, there's not really any clear evidence to show that Evusheld caused these cardiac events. Also, due to the possibility of the serious injection reactions, such as anaphylaxis, you do want to make sure you monitor your patients for at least an hour, and that is required observation for an hour per the EUA after administration. Other adverse effects, which weren't very common, are headache, fatigue, and cough, which, like I said, are minimal and not super common. So that is the rundown of Evusheld. Evusheld is very effective in the prevention of COVID-19 infection for those who are eligible. It's also a very underutilized product. VDH does encourage providers to engage eligible patients and discuss that this is a valid option for our immunocompromised patients. With that being said, VDH does have plenty of Evusheld to go around. So if your practice or facility is interested in administering Evusheld, you can contact us at COVID-19, so that's COVID-19, therapeutics@vdh.virginia.gov. And thank you for listening.